Good afternoon. Good afternoon, everyone, and welcome to the Black Health Trust weekly program. We're so pleased you've chosen to empower yourselves today by joining us. It's great to have our regular attendees back and those new to the program. My name is Michelle, and I'm your hostess for today. I hope you are all doing well from wherever you're joining us. So today our panel will be moderated by the distinguished Dr. Randall Maxey, Chief Medical Officer of Advanced Community Medical Care Corporation in Los Angeles and President and Founder of Black Health Trust. He will introduce his terrific co-moderators and guest presenters today. BHT was founded in response to the global pandemic and Dr. Maxey's desire to keep his own family safe, and fortunate for us, his commitment evolved into a much larger vision as you see today. The purpose and mission of the Black Health Trust is to provide credible insights from our community health experts to best serve our communities of color with a coalition of leading and long-standing Black medical professionals across a diverse spectrum of disciplines to offer unvarnished opinions and insights into our physical and mental health during these challenging times. These opinions are offered to help educate and inspire you to take your health seriously and to ask questions of your own medical practitioners. So now I'll share just a few housekeeping items and announcements for the program. This video conference is a live program and is being recorded on different public platforms such as Facebook Live and YouTube. Your participation on the program is completely voluntary, and if you choose to participate today and prefer not to have your image and likeness displayed, there are visual and audio settings on your personal device you can use to block your picture and mute your voice. That said, all participants will be muted by our Zoom technician initially. We ask that you remain muted until the host or moderator asks you to contribute in order to minimize the distraction of background noise so that we can give 100% attention to our speakers. So just double check and make sure your device is muted until called to speak upon. With regards to the chat room, if you have questions, you may enter them into the chat room, but please limit your questions to 2 questions per topic being addressed. And we also ask that you do not use the forum to advertise or promote your own personal products. Let's read the disclaimer. I put it in the chat room as well, but there are people on Facebook Live or YouTube may not be able to see this, so I'm going to read it for you. Please note that the information communicated on this program is not intended or deemed to be medical or legal advice, and you should always consult your own medical or legal professional for advice and direction pertaining to your particular situation and needs. The information presented here is not advice, but rather opinions and recommendations from credible sources. Black Health Trust, its representatives, members, employees, attendees, heirs, assigns, and guest speakers and presenters assume no liability whatsoever in connection with the information presented or used by anyone, nor are these discussions directed to specific situations. Again, we strongly encourage all attendees of the program to consult their own legal or medical professional for conclusive guidance on how to proceed in your own personal circumstances. So we are in this together. If this program has been valuable and interesting to you, please visit the website to learn more about our programming and how you can support Black Health Trust, affectionately known as BHT, so we can continue bringing our community outstanding content. Visit blackhealthtrust.org. www.blackhealthtrust.org. So we want to thank the Black Health Trust Steering Committee, the Executive Board, its virtual assistant, administrative assistant, our production and Zoom technician, BHT supporters, and all the people behind the scenes for their time and efforts that make this programming possible. Now let's give a warm welcome to all of our distinguished physicians and special guests. We thank you so much for sharing your valuable time, your information, and educated insights with us today. And know that your participation and support helps to empower our communities of color. And this is critical, so critical to our present and future well-being as a people. Black is beautiful and knowledge is power. Welcome again, everyone, to the Black Health Trust weekly program. This is our community and this is our time to take care of our health. Dr. Maxey, I invite you to do us the honor of moderating today's program.
Thank you so much, Michelle. I appreciate seeing you every Sunday. That's why I get up on Sunday morning, so I can see you. Oh, well, thank you so much. I'm extremely excited about our program today. Many of us have been practicing medicine for many years, but there are certain people that we who've been at the so-called top of medicine, we know that we're really not at the top. What we have today and our guests are some individuals who are really at the top of medicine. The people whose shoulders that we stand on, the people that the most famous of us call icons. And I hope you will enjoy it and begin to feel like we feel, that there's a certain depth of information, a certain amount of gravitas that these individuals are bringing to the table. So we want to make sure that you know what we intend to do. We want to provide credible information about health disparities, about COVID-19, but importantly about the confidence that we want you to have from trusted messengers. Who are we? What is our background? Why can we provide you health and protection? The ice at certain hospitals and institutions is not necessarily colder. If it is, it's because some of us run those institutions. So we're going to introduce them. I'm going to ask Dr. Nabert, who is my associate moderator. She is the vice chairman of the board. And I'm going to ask her to introduce all of the speakers in detail. And also there's Dr. Ivan Walks, who has joined us as of last week as our co-moderator. Dr. Walks is former commissioner, head of medicine, the health department in the city of Washington, D.C. Welcome, Dr. Walks. But if Dr. Nabert-Stephens would introduce all the speakers, and then right before they speak, we'll introduce them again. I think it's very important you know who we've been able to bring to the table for your listening pleasure. Dr. Nabert-Stephens?
Thank you so much, Dr. Maxey, and good afternoon, everyone. It is indeed my pleasure to serve today as your co-moderator. And I'd like to say that even though the day is January 31st, I think we can really think of today's program as a tribute to Black history, because we certainly have some giants among us. I am going to give you sort of an appetizer intro to our panelists and give a fuller introduction when they are about to speak. But let me start by just saying a word or two about our founder, who sometimes is very modest. He too has quite a history and has done a lot to influence not only the health and welfare of his patients, but also many, many young people have come under his influence, and he has served as a mentor to them, myself included. Dr. Maxey is a renowned nephrologist and an expert in the cardiovascular diseases that travel along as co-passengers with renal disease. And as Michelle said, had the foresight to put Black Health Trust together. Dr. Walks, who is a psychiatrist by training, has come to join us and has brought wonderful insight and skill sets to the work here at Black Health Trust. He has served previously as a District of Columbia Chief Health Officer and is the CEO of his own health consulting company. He is dedicated to the issue of establishing health equity and improving health in our community, and has had interesting opportunities to expand that, including an audience with the Pope. Our first speaker today is going to be Dr. LaTanya Washington, who is double boarded, completing a combined program in internal medicine and pediatrics, and also has her MBA. I'm not sure, I meant to ask her if she was a native of Memphis, which I am, but she is the current president of the Bluff City Medical Society, which is the premier organization for physicians of color in the Memphis metropolitan area and a subsidiary of the National Medical Association. She maintains her active clinical privileges while also pursuing multiple activities, as we all do. She is passionate about bringing awareness to social injustices, identifying and improving health equities through improving health literacy, and healthcare access. She is committed to educating the community on health-related topics, most notably COVID-19, which is what she's going to speak with us today about. But one of her most recent exercises in that is serving as medical media correspondent for the Memphis and Shelby County Joint COVID Task Force, among other such activities. We are going to have a panel that will be moderated by Dr. Maxey. The panel is going to consist of Dr. Richard Allen Williams, who is a cardiologist and a former president of National Medical Association and the founder of the Association of Black Cardiologists. He has had multiple academic appointments and is, and interestingly, did not include in his bio, but I happen to know anyway, that he is the author of several books, one of which is one of the leading sources of information about the history of Black physicians in medicine in this country, and has a new one that recently came out. Our next speaker is Dr. Louis Sullivan, who is a hematologist by training. Dr. Sullivan has a number of firsts that he is the owner of. I'm not even going to say them in an order of rank. There's so many that are just awe-inspiring. How many times do you get to talk to somebody who helped found a medical school? But before he did that, he had been in the Boston area working with students in the Boston area, as well as at BU in the Department of Hematology. He is a former secretary of the U.S. Department of Health and Human Services, and actually interrupted his tenure as president at Morehouse Medical College, which he helped found in 1975, to do that tenure between 1989 and 1993. When that was completed, he returned to Morehouse, where he retired as president emeritus in 2002. Now, I am leaving out a lot of things, and I would encourage you to Google him to see some of the other major accomplishments that he has achieved. Our third panelist is Dr. Augustus A. White III, who is an orthopedist. Dr. White is another giant that has many accomplishments to his name. He was the first African-American student at Stanford and surgical resident at Yale University. He served as Brown University alumni trustee and was at Harvard University as a professor in orthopedics. Now, he has retired, but has been very active in the area of writing and researching and speaking on diversity and cultural sensitivity in medicine. That is not a new topic. And I am sure the perspective that Dr. White has on that is a very interesting one. So without further ado, I turn it back over to Dr. Maxey.
Thank you very much. And I've got goosebumps waiting to hear from these speakers. But first, let's bring to the floor Dr. Washington. Welcome to the Black Health Trust. And please feel free to share your slides.
Hi, good afternoon, everyone. First, I will say thank you for this invitation. I'm certainly honored and humbled to be in the presence of such giants. You know, pretty much everyone on this panel I probably read about during my medical school and training. So I'm just happy to be in the same virtual space with you all. So thank you for having me. So I'm going to share my slides here. I do have several slides, but I plan to go through them quite quickly. So I am talking today about COVID-19 in Memphis and access for communities of color. As Dr. Nabrit Stevens stated, I am the president of the Bluff City Medical Society, and I also serve as physician advisor at St. Francis Hospital and assistant professor at University of Tennessee Health Science Center. Let's see, I'm having a few technical difficulties here. There we go. So as far as Memphis demographics are concerned, our population is about 650,000. We are unique in that our population is about 64.1% Black. And then when we drill down and talk about education, about 26.2% of our population has bachelor's degrees. About 15.5% of our population under the age of 65 do not have health insurance. And the median household income for Memphis is about $41,000. The percentage of our population below the poverty level is about 25%. So about a quarter of people that live in Memphis live below the poverty line. When we talk about Memphis, it also includes Shelby County. Often we consider Shelby County to be kind of Memphis metro area. That population is almost 1 million, 54.3% Black, 6.6% Latino. The percentage of that population below the poverty level is 17.2%. And that's based on the census data. So when we talk about COVID-19 in Shelby County, total cases, this is as of Friday, about 82,000. We've had 1,252 deaths. That's about 1.5% mortality rate. This week, our positivity rate was 9.7, which is down from a high that we had of about 17.6. In Tennessee, about 610,000 cases and a death rate of 1.2%. One of the things that's very unique about Memphis and Shelby County is that we border 2 states, Mississippi and Arkansas. I can get in my car and drive 20 minutes and be in Mississippi, 20 minutes south. And then if I drive 20 minutes west, I'll be in Arkansas. And we have to understand that many people live, work, and play between 3 states. And so that's very important when we're looking at disease processing and tracking. So when we talk about cases by age, this is the data from our county website. Again, this is not unique for Memphis. I think it could be extrapolated to many major cities, but our highest number of COVID-19 cases are really in the younger population, the 25 to 34, the 35 to 44 age group. We know that those individuals don't always have severe COVID disease, but they are infectious, and we think that they tend to spread COVID-19. So when we look at Shelby County COVID cases by race, this is where we start to see the difference. So African Americans actually consist of 56% of the COVID-19 cases that are in Shelby County. And then when we look at ethnicity, those that are classified as Hispanic or Latino make up 13% of COVID-19 cases. If you recall back on the slide of demographics, in Shelby County, the Latino population was about 6.6. So this group is also overrepresented. So when we look at the number of cases per 100,000 population, for those who are familiar with Memphis, I know Dr. Nabrit Stevens is, but Memphis has a very large demographic. When we look at, if you see that the word Memphis on that slide, anything that's below that we consider to be South Memphis, and that population tends to be quite underserved. So the dark red colors are the increased number of cases. My concern when I saw this map was that in the areas of South Memphis, I think that those people are not being tested at the same rate. And so that's why we're seeing that lower number of cases. When we talk about COVID fatalities, again, 58% of the COVID deaths in Shelby County were of Black or African Americans. And that's something that we should be alarmed about. So when we switch and talk about the vaccine, we utilize our state health department guidelines. Again, this is very similar across states. We are currently sitting in the A12 and the 1B category, where we need to get vaccines out and into people's arms. And there's a large number of people who are interested in getting the vaccines. One of the things that I will bring your attention to is at the top of this slide, equity is a cross-cutting consideration. So that is something that we need to keep at the front of our minds throughout this pandemic. So not only are we dealing with vaccines, we're also dealing with vaccine hesitancy. We know that there's a large amount of the population that say that they won't get the COVID vaccine. 27% of the US population and 37% of Black Americans say that they won't be vaccinated. And so when I heard this number initially, I was like, well, surely it won't include the essential workers and the healthcare workers, but there are actually people in those groups that also say that they don't want to be vaccinated. So then we have to talk about the mistrust. 47% of Black Americans say that they don't trust vaccines in general, or they're worried that they'll get COVID from the vaccine, meaning that we need to educate our population. So this is a graph from Kaiser Family Foundation, just talking about the different groups. This was produced in December of 2020, talking about the groups that will be more likely to be vaccine hesitant. So the reasons for vaccine hesitancy, I pulled this out specifically so that we can look at the race and ethnicity category and looking under those identifying as Black as far as what they were concerned about. And that is worried about side effects, worried that the vaccine is too new and it may not be safe, worried that they will get COVID from the vaccine. So all of these things are things that we address in our various sessions. So then when we talk about access, we talk about equality and equity. That is a major concern in other countries. It's also a concern in the US. So when we talk about Shelby County specifically, the initial vaccine rollout to this group 1A1, so people who got the vaccine outside of hospitals, there were 10,800 appointments and there was only online sign up available. 40% of those appointments filled up within the first 3 hours of that website being open. And then within 48 hours, there were no appointments remaining. So we have to think about marginalized groups. What about people that don't have online access? Of note is that the telephone access for these appointments were not available until 3 days after the initial rollout. The health department also did not set aside a number of vaccines for telephone call-in. So when we know that elderly people will be left out of this. A lot of elderly don't utilize the internet very much. There's also a large population of patients in the Memphis area who don't have internet access. And then we have to think about the highest risk individuals for the disease and having confounding conditions. So are these patients elderly, living below the poverty line, and don't have internet access? All of those things are confounding. And so then when we look at specific zip codes, which we saw back on a previous slide, in South Memphis, the zip code 38126 has the highest poverty rate in the city of greater than 65%. That population is 96% Black, and greater than 70% don't have internet access per the census data. So we see that that is an issue. So when we talk about vaccine distribution in Tennessee, about 40% of the state's vaccine supply has been distributed. Only about 55% of people receiving vaccine indicated their race. So there is a lack of information there. We can't adequately assess that information if we don't have it. So less than 4% of the vaccines delivered to Black Tennesseans, although Tennessee is 17% Black by population. And in Shelby County, less than 2% of the population was vaccinated in total. And so in Shelby County, we have the percentages here. Again, whites received 51.9% of the vaccines, Blacks received 24.4% of the vaccines. Remember, in the previous slide, I stated that African Americans make up about 64% of the population in Memphis. However, they have only received 24.4% of the COVID vaccine doses. And then when we look at Mississippi, Dr. Nabrit Stevens, you asked if I was originally from Memphis, and I'm not. I am a Mississippi girl. But we see that the numbers in Mississippi are a little bit worse off in regards to the demographics. And so when we talk about this category of marginalized individuals, I call them the least of these. That is how I learned it growing up. You know, the elderly, the poor. What about people who utilize public transportation? What about people that don't have transportation? In the city of Memphis, all of these public vaccination efforts are drive-through services. They don't have the ability to walk up. So that is a problem. Again, we have a large population of people who don't have internet access. The younger population tends to have cell phones, and so they do have that access. But then we also deal with low health literacy. We have to talk about people who have a lack of work flexibility. When you log on to that website to get your appointment for the COVID vaccine, you have to go when that time is available. You don't have the luxury of taking off work. You may miss income. And so that's a concern. Also, when we talk about language barriers, we do have a large Latino population. And although some of the information is available in Spanish, not a lot of it is available. And I believe that those patients are really being left out. So how do we fix this? Number one, a robust public health education campaign. We have been doing this with the Bluff City Medical Society. We've also had community group education initiatives. I sat on a multitude of panel discussions, answering questions. We have to ensure that vaccination sites are available in communities that have the highest number of COVID cases, and they have to have walk-up access so that people who don't have transportation can get to these sites. And then we have to think outside the box. What about RVs to do mobile vaccinations in the poorest communities? And engaging with community groups that will routinely reach the marginalized, such as churches, civic organizations, and organizations such as those. So overall, it really takes a village to be able to affect this issue. Physicians of color must have a seat at the table on state and county health boards and on COVID task force. We have to continue to utilize our voices. Webinars and panel discussions do improve education, and we have to think outside the box on vaccine delivery. So I encourage everyone here today to visit us at the Bluff City Medical Society webpage. We did recently do a COVID webinar that is available there, and also on our social media sites. And also I have my own webpage that you can follow as well. So I thank you for this opportunity, and I'm happy to be included on this presentation.
Thank you so much, Doctor, for an outstanding presentation. There are some numbers that are quite disturbing. As we look at the chat box, Dr. Nabert and Michelle, to what do you attribute the disparity between the percent population of African Americans and the distribution of the vaccines?
You know, I think it's a number of things. I think that it's, you know, number one, we have a large population who's hesitant to receive the vaccine. They don't trust the vaccine. And then the second thing is not knowing where they can get the vaccine from. So I think it's really important as healthcare professionals that we really provide them information, make sure we continue to fight on a state and local county health department basis to get those vaccination sites to be in areas where those marginalized people are, so that they can get the vaccines injected.
Michelle, are there any questions in the chat box?
Just one thus far. It says, does Memphis use a tier system for vaccine distribution, or is the data coming from all populations or just those within the tiers thus far, if in use? Oh, you're still muted.
There we go.
There you go.
So Memphis does have a tier system, and we are utilizing the tier system for vaccine delivery. We're currently on the age 75 and up, and the A1, the 1A1 category.
Okay, and that's where that data is derived from, those tiers. Okay, and there's another question here. Is testing data used to inform vaccination?
I'm muted again. Oh, here we go. Okay. So they do utilize testing data. I believe that they utilize that information to know the areas where the number of COVID-19 cases are the highest in the city. And from my understanding and the information that I have received here over the past 24 to 48 hours, the county health department has chosen to open up an additional vaccination site in the South Memphis area where those numbers are the highest.
And do we have time for another, Dr. Nabert-Stevens, or do you want to jump in there?
No, right. Let's let this be the last one from the chat.
Okay, awesome. Do you have any suggestions about how to help people in marginalized communities sign up if they have limited access to technology? Dr. Washington.
You know, that's really been a challenge. Prior to the pandemic, a lot of our marginalized communities would go to areas where they had Wi-Fi access, the libraries or computers, or to areas where computers were available. So that's really been a challenge. One of the ways that we can combat that is to go into those communities and assist people with signing up. Also, after the initial rollout where the telephone sign up was showing a disparity, they have since increased the number of vaccination appointments that are available from the telephone sign up, and they have set aside some vaccines for those who will be able to call in to schedule those appointments.
Well,
I'd like to summarize the or bring this set part of the panel today to a close by saying that we have had now presentations from Buffalo, New York, and the Erie County area, from Pittsburgh, and now Memphis. And I think it's very important that we understand, well, and we actually had a report from South Africa as well, I forgot, and Jamaica. It's important for us to hear from the people on the front line, in the trenches, what is the reality of the situation, and help others of us in other areas of the country know what to be on the lookout for as the whole COVID initiatives roll forward. I want to thank Dr. Washington for sharing the Memphis experience. She has provided her contact information, and I encourage you to reach out to her if you have any additional questions. Dr. Washington, we invite you to stay on if you can. There will be additional question and answer periods at the end of the program, but if you have to leave, we understand.
Thank you, Dr. Washington. Here in Los Angeles, the Charles D. Lester Society has always been in frenemy competition with Bluff City to be the most outstanding chapter. So it's good to meet such an outstanding young physician and their leadership. We might lose to you this year, I think. Let me go to my slides to introduce the panel. Simon, if you show my first slide. Go to the statistics. Okay, and I'm going to ask Dr. Walks and Dr. Nabert to help me with these. One, we know that the total number of cases back in November the 22nd, there were only 11 million cases in the US, 11,843,493, and there were 93,811 new cases. And the total deaths at that time was 253,600 deaths. Let's go to the next slide. So as of today, the total cases were 25,730,144, with 164,876 new cases. The average daily cases per 100,000 in the last 7 days were 46.3. The total deaths in the US stand now at 435,151, with 3,532 new deaths in the last 24 hours. And I added a new category, the total vaccines administered so far have been 29.6 million doses of vaccine. And we know that that availability has not been as much as we thought. We know that there's a disparity of how the vaccine is given. Yesterday at Dodger Stadium in Los Angeles, which is the largest site for vaccines, certainly in California, if not the US, a group of so-called anti-vaxxers came to the stadium, interrupted people getting the vaccine, screaming and hollering at them, telling them that they were being poisoned, that they shouldn't take it. And police had to shut them down and discontinue vaccination for about an hour. And then they did resume them. So we do have a lot of political intrigue going on. I'm going to ask, as we go on, we're going to have questions of the leaders that we're going to meet now. But we have determined as a group that we recommend vaccination for people of color. And the way we arrived at that, the National Medical Association formed a vaccine task force, and they met with the FDA, CDC, Pfizer, Moderna, with a group of world-renowned experts, and they put out a statement. We got the statement when the Black Health Trust, we formed our own task force to relook at their data, and that task force was led by Dr. Ivan Walks, and we met with some 15 of our own experts, and we voted that we would recommend that the vaccine be given, and that the thought that people would die was something that was driving us. We thought that the science was good and the risk was relatively low. The benefit risk analysis was in the favor of taking the vaccine, even though we know some people have allergic reactions and untoward actions, but you can choke on a glass of water. So with that said, I want to introduce our distinguished panel. Dr. Richard Williams had agreed to be the producer of this, and he brought these gentlemen together. Dr. Richard Williams has been my mentor since I was a Cub Scout medical student. And when he recruited me to Boston, he was in charge of, he and Vivian Penn of the Boston Recruitment Council. And they tried to get a number of us to come to Boston to be a part of the Harvard school system. And at that time, I did meet briefly Dr. Louis Sullivan, Vivian Penn, and I'm honored years later to have him on this broadcast. I will also say that Dr. Williams is the founder of the ABC, the Association of Black Cardiologists. He gave me my first opportunity to publish as a young author in the Black Related Diseases textbook, which he edited. And he's now produced some 9 books. And the last book and the first book are both now in the African American Museum in Washington, D.C. So welcome, Dr. Williams. How are you today?
I'm fine. Can you hear me, Dr. Maxey?
Yes, I can. And
Thank you.
what I'm going to do, since you are the producer of this and I'm the moderator, I'm going to ask you to briefly introduce Dr. White and Dr. Sullivan, as only you can.
Oh, my goodness. Shall I do that first before making my own remarks?
Yes.
We do it in rotation.
Why don't you follow your head?
Okay. I'll make some remarks first and then introduce them in due order. The first thing that I want to say is thank you very much for setting up this program. I hope everybody recognizes that our panel discussion is not really a change from the issues that have been brought up regarding COVID-19. This is really a segue from one important item across sort of a bridge, which is provided by the Black Health Trust, to some other issues, related issues that we are going to be covering today in this panel. And I'd like to speak for myself, I guess you might say first, and introduce myself a little bit more. I am Dr. Richard Allen Williams, and I emphasize Richard Allen because I'm named after the founder of the AME Church, Bishop Richard Allen, who founded the church back in the 1700s. I'm very proud of that. And
I have to ask you one question. Were you there then?
I might have been. I'm kind of a dinosaur, and I appreciate the the question that the point that you're making. Yeah, I'm a little bit old, but still very vibrant, I hope. In any event, I hail from Wilmington, Delaware, which is the hometown of our new president of the United States, who was a family friend back in Wilmington. And to kind of complete the circle on that, I've been appointed to Joe Biden's Health Advisory Committee and hope to be able to make some significant, deliver some significant messages and have some impact on our health outlook looking forward. There are some folks on this program as listeners or participants who are in Wilmington right now. And I'd like just to give a shout out to them and say hello. Some of them are my relatives, others are friends. So moving further forward, I want to mention the fact that we are on the cusp of what we call Black History Month. And there's a lot of tradition and history that goes into that, the founding of this month. Before I go any further, I want us to recognize the fact that Black history is extremely important for us to recognize. We're doing some of that today with these historical panelists that I'm serving with, such as Dr. White and Dr. Sullivan, but also in regards to the fact that it provokes memories of those who have gone before us and have done significant things. And so I want to call these things to mind because we tend to forget them. And sometimes they only come up, if they come up, during Black History Month. I'd like to indicate some Black inventors who have been very significant and important in our history. And I'm going to do this real rapidly because I've got a list here that I want to read to you so that everybody who is within the sound of our voices will recognize the importance of these ladies and gentlemen. The first is the inventor of the refrigerator, John Standard, in 1891. Next, the traffic light, Garrett Morgan in 1922. The air conditioner, Frederick Jones in 1949. Fourth is the clothes dryer. How about that? G. Sampson in 1892. The elevator, Alexander Miles in 1887. The guitar, R. Fleming in 1886. The automatic air brake, Granville Woods, who invented several other things, in 1887. The electric lamp, Lewis Latimer in 1881. The fountain pen, William Purvis, 1890. The lawn sprinklers, how about that? Elijah McCoy in 1891, who also invented the coupling system used on trains called the real McCoy. And finally, but not last, is Dr. Patricia Era Bath, who is a Black lady physician who recently passed away from Los Angeles, served with me on the UCLA faculty at the medical school, who invented a laser technique which was a precursor of the current LASIK eye treatment in ophthalmology. I don't know how many of you knew about all of those things, but now you know, and I want you to make sure that others know about those inventions too, and those brilliant inventors. So moving forward very rapidly, I just want to make several other points before I introduce my distinguished fellow panelists. The first thing that I want to mention is what I call, and this is being articulated for the first time on this program, the Black Health Trust, what I call the Williams Principles. Remember that, the Williams Principles, which I'm enunciating to help the younger generation start their careers and imagine what they can do in not only medicine, but in other areas of life. And there are 10 principles, which I'll mention very quickly. I don't have a slide showing this, but the first thing that I want you to do is to proclaim your belief that Black lives matter. That's number one in regards to what we need to be concerned about. And I'm proud to be able to say that. This harks back to the time that we had to urge people to say that they were proud, Black and proud. And so remember, Black lives matter. The second principle is that you need to celebrate our Black heroes. This is something that came up in Dr. Maxey's mind when he came up with the idea of starting this program, to bring forth to you heroic Black figures so that you could kind of morph onto us and to the Black heroes and pass the word on to others. The third principle is that you need to seize the time. If you've heard that term before, it might resonate with you. That came from a member of the Black Panthers, who was Elaine Brown. And even though you might not agree with all the things that the Black Panthers said or did, remember that a lot of things that they articulated, and I was there when many of them were articulated, were very important and should be important to us. The fifth thing is that in articulation of another one of the Black Panthers, who was Eldridge Cleaver. And that was either you're part of the solution or you're part of the problem. And that's not my principle, that's his, but I'm incorporating that into my list. The next is that you need to become a role model. After you follow a role model of your own that you selected and you become successful, you need to become a role model for others moving forward. And then they will become role models for others. So it's a process that is linked together. And you can start with your parents, who should have been your role models, and continue with your children. You become their role models. The next principle is that we have to be concerned about doing something that is enduring, that will continue our legacy. If you think you're good enough to have established a legacy, you need to make sure that that legacy is going to continue. And remember that if we pass away, all of a sudden we're gone. People might not think about us or remember us. And so one of the best ways of enduring your legacy is to write something. Dr. White and Dr. Sullivan, and I guess I, have written some things that we hope will be passed down through history, and people will remember us through our writings. The next one is that you need to listen. Someone famously stated that you can't learn when you're talking. So become a good listener and listen to all of the people that you can. They've got a lot to offer to you, especially those who are older than you are, like me. And in regards to age, remember that you're never too old to start something important. And I call out to those who are on the line now on this program to invent something, begin something, so it goes back full circle to those inventors that I talked to you about. Many of them were very young when they started something. Last thing in my part of this is to point out to you what I said about something that I have written. Randall, I don't know whether you have that slide that I sent to you about my book, which I want to promote to you, not just because of the fact that I wrote it, but because it contains a lot of principles in it, which we can use especially in the moment regarding issues of social justice, and also to make sure that we all know about the 5,000 years of Black medical experience, which we need to recognize. And that's what's contained within my book, which is called Blacks in Medicine, Clinical, Demographic, and Socioeconomic Correlations. And if you don't have the slide, I'm going to hold the book up here for you now so that you can perhaps see it. Don't know whether you can focus on that, but Dr. Maxey will have the information that you might want to use to order that book from Springer or from Amazon. It's recently published. I think, frankly, you'll get a great deal of information out of it that is useful, as I said, in the moment that we find ourselves in, especially regarding the COVID-19 crisis. So I want to end my part there and perhaps say some other things that Dr. Maxey may pull out of me down the line. Before I go on, then, I want to thank him again very much for this opportunity and introduce my next recruit, I guess, for this panel, you might say, and that's Dr. Louis Sullivan. Dr. Sullivan has already been introduced to you in one form, but I want to mention that I consider him an associate for a long period of time. Dr. Sullivan, Dr. Augustus White, and I were actually compatriots and contemporaries in Boston back in the late 1960s. Isn't that right, Gus and Lou?
That's right. That's right.
And we worked together and separately on health problems. One of the things about Sullivan, Dr. Sullivan, that is not generally recognized and needs to be, is that in history, he has been the highest ranking Black, not only doctor, but Black person involved in governmental medical affairs in our history as the Secretary of Health and Human Services during the first Bush administration, George H.W. Bush. And I want to mention something that he may not bring out, and that has to do with something I know about regarding Uptown cigarettes. Maybe Lou will elaborate on that very important juncture in history and focus on what he did to make sure that we as Black people were protected through his efforts. He is also, as was mentioned, the not only one of the founders, but the founder of the Morehouse School of Medicine. And I was able to interdigitate with him at that time. After he founded Morehouse School of Medicine, MSM, he invited me and a number of members of the ABC, Association of Black Cardiologists, to come to the Morehouse campus when we were meeting in Atlanta that year. And we went there and he had invited us to speak to give inspiration to his medical students there. And we were happy to do that. I was particularly moved by that invitation. And one of the medical students that is actually now my doctor, Dr. Dwayne Bridges, who may be on this call, was in that audience as a medical student. And it was that at that time, as he proclaimed to me, that he became determined to become a cardiologist. So I subsequently became his mentor as well through his cardiology training. I'm very proud of that. And I don't know whether Lou knew about that. But I won't hold things up any further. I think you need to hear from him. And then after he finishes his presentation, I'll then introduce Dr. Augustus White.
Thank you, Dr.
Sullivan?
Williams. Dr. Louis Sullivan, we so much appreciate you today in many, many ways. And we appreciate you addressing us for a few minutes and any way you wish. And I'm sure we'll have a number of questions and discussions with you. So Dr. Louis Sullivan.
Well, thank you very much to all of the participants, to Dr. Williams, Dr. Maxey, my colleague, Dr. Gus White, and others. I'd like to comment on the themes in my life that have inspired me to be involved in the activities that I have. I was born in 1933 in the depths of the Depression in Atlanta. My father moved my family to Southwest Georgia, to a small town of Blakely, where he established at that time the first funeral home for Blacks in that town. My father was a very active person politically, trying to get Blacks registered to vote. He brought suit against the state of Georgia because of the white primary that Blacks were not allowed to participate in. He started the annual Emancipation Celebration there in Blakely, January 1st of every year, to celebrate the contributions of Blacks to the country. And he was active in many other things. Fortunately for my brother, Walter, and I, who was a year and a half older, my parents knew that education in rural Georgia in those years for Blacks, in the years of segregation, education was not very good. So they sent me and my brother to live with relatives in Savannah when I was in 5th grade, the following year to Atlanta in 6th grade. And we remained in Atlanta for the rest of our high school years with my parents in Blakely. They did this because they were committed to us becoming educated as much as possible. So they were my role models. But also in Southwest Georgia, I was influenced by Dr. Joseph Griffin, the only Black physician in Southwest Georgia at that time. And my father, being a funeral director, also had an ambulance service, and he frequently took people from Blakely and other places nearby down 41 miles to Bainbridge, where Dr. Griffin's clinic was. He did this because many Blacks did not were not happy with the indignity of having to go into a separate waiting room, usually around the back of the building, with the 2 white physicians in Blakely. So when my father would take people to see Dr. Griffin in Bainbridge, he would take me along, although I was only 5 or so years old, he said, to help him. In retrospect, I knew my father was bringing me under the influence of Dr. Griffin because I was very impressed by him. He had a brick clinic. He was highly respected. He really, in my view, performed magic. He was able to cure people of illness or fix fractures or do surgery. So I told my parents when I was around the age 5 or 6, when I grow up, I want to be like Dr. Griffin. I want to be a doctor. So he was one of my early role models. I finished Booker Washington High School in Atlanta in 1950, went on to Morehouse College because many of my classmates were also going there. And Morehouse was well known for having a strong pre-medical program. There I came under the influence of Dr. Benjamin E. Mays, our president, very eloquent, man of great integrity, and someone with high academic standards. The culture that he and his colleagues on the faculty at Morehouse College created for me and for many others was one of great inspiration, great challenge, a great commitment to service. Dr. Mays would say things such as, you should live your life so that it means something important to others. So we were taught the value of pursuing a career that would be important to others. I went on to medical school at Boston University and had a great experience there, but that was at the age of 21, for the first time in my life, living in a non-segregated environment. My classmates had come from Princeton, Middlebury, Yale, Amherst, Harvard, Columbia, and elsewhere. All of my classmates had finished first or second or third in their class. And I wondered, well, I'm from Morehouse, which most of them had never heard of. And I wondered, well, how am I going to do with, in comparison with these guys who've come from, and gals, a few at that time, who've come from larger, more famous, longer established institutions. Fortunately for me, we had our first examination 3 weeks after we had started, and I did very well, and I relaxed because I then knew that my preparation at Morehouse was just as good as that of my classmates from these other places. And I ended up being class president for 2 years and finished third in my class when I graduated. So that was the preparation that Morehouse College had given me to compete with my colleagues. I went on and became a research hematologist. That had not been my intention when I went to medical school. I had intended to train as a primary care doctor, go back to Georgia and be like Dr. Griffin to serve my community because of the shortage of Black physicians. But I learned a lot about medicine I had not known when I entered medical school. So I ended up going into hematology and becoming a researcher, and became professor of medicine at Boston University and chief of hematology at the Boston City Hospital. But along the way, I went to Cornell Medical Center for my internship in 1958. I mention that because in 1958, in New York, most cosmopolitan city in the United States, in 1958, I was the first Black intern that ever had in their history. There, the chairman of medicine interviewed me, and I had not known him because I had really applied thinking perhaps I would get into Bellevue, but I didn't think I would get into New York Hospital or Presbyterian. But my first interview was done by Marvin Schlesinger, who was chief of the gastroenterology section in the Department of Medicine. At the end of that interview, he asked if I could stay to meet the chairman of medicine. I had not bothered to get to know who the chairman of medicine was because I thought I would be simply getting some experience in doing interviewing and I would not get into that institution. But it turns out I went in to see Dr. Lucky about 30 minutes after Marv Schlesinger had interviewed me and met Dr. Lucky. When he stuck out his hand, he was a very stocky fellow, had a florid complexion. And when he stuck out his hand to say hello, he had the thickest Southern drawl I'd heard in years. And I then thought, oh my goodness, why are they doing this? I said, they're just trying to go through the motion. But to make a long story short, I was accepted. And while I was there for 2 years, and Hugh Lucky became a very strong supporter. That taught me a lesson because I had immediately formed an impression of him because of his Southern drawl. I learned later that he had come up from Vanderbilt about 12 years before and became chairman of medicine. Another thing about him was some years later, in 1975, when I started the Morehouse School of Medicine, he was on the board of the Macy Foundation, and the first grant I received was from the Macy Foundation. So that was really a lesson for me. I returned to Boston for my training in hematology, and as I mentioned before, became chairman of the hematology division at Boston City Hospital. But by 1975, a number of new medical schools were opening, and Morehouse College decided they wanted to explore the development of a medical school. And I worked with them as an alumnus of the college, along with other alumni of the college, in providing recommendations. And when it came time to look for a dean, I sent the names of 11 people to them I thought who would be very good. And Joe Gales at Morehouse College, to whom I'd sent the list, called me 2 weeks later to thank me for it, but said that it was very impressive, but they were disappointed that I sent an incomplete list. I said, Joe, what are you talking about? I spent a lot. And then I said, oh, no. If you're saying that you wanted me on the list, I am really a research hematologist. I have a training grant. I have fellows being trained, et cetera. And my wife is from Massachusetts, so I'm not the person you're looking for. But he convinced me to come down to New York to meet with the Board of Trustees, not as a candidate, but as a consultant, to advise them how I thought such an institution could develop. And without going into detail, I'll tell you that meeting with them was one where I think, talked myself into a job. Because after 2 hours telling them how I thought such an institution should develop, Hugh Gloster, who, by the way, had come from Memphis, grown up in Memphis, Hugh Gloster, who was there with the group of about 15 people at the New York Hilton Hotel, said, well, Brother Sullivan, he was an alumnus of the college himself, so I always address fellow alumni as brother. So Brother Sullivan, thanks for coming down. We appreciate your input. You have great ideas, and I can't speak for the committee, but I'm convinced you're the man we need to do this. So you do your alma mater a great service and a great favor if you're willing to do this. Well, yes.
I have a very important question to ask you.
Yes.
Given our current crisis, if we were to put you back in as Secretary of Health today, what would you do to save us? And how would you see this process going? Nobody has ever, and I visited you several times when you were Secretary of Health, and I'd never been in a building that big, and certainly not an office that big, and certainly not where my assistants were brigadier generals and other white House fellows, etc. And I know how much you helped me in Zimbabwe just by a phone call to the Fogarty Institute. But right now, in the middle of this crisis, with more than 400,000 people dead, if Dr. Lou Sullivan were back in charge, what would you have them do?
Excellent.
Well, several things. First of all, there should be greater coordination between the federal and the state governments. That was a major error that occurred when the federal government, in essence, developed their own plans without coordinating with the states. So the problem, first of all, let me say the scientific positives here. The development of this vaccine was rapid, but it was really done under the most rigorous scientific criteria. So it is a safe vaccine, it's an effective vaccine, but using technology that enabled them to develop it within a short period of time. The logistics were also to provide support to pharmaceutical companies to gear up to produce large amounts of the vaccine. That also shortened the period of time it took to get the vaccine available, because usually a pharmaceutical company will develop a vaccine to show that it's safe and then it's effective. And when they then do that, which is usually a year or two or three or four, then they invest the millions of dollars to enhance their capability of producing large amounts of the vaccine. But this time the federal government did this from the beginning, so that when we then had a vaccine developed, the federal government was ready to go. That was very positive. What was not done was the coordination of planning with the states. And the problem we have right now with distribution is that the states don't know when the vaccine is going to arrive and how much will arrive, because you have to have people in place, you have to have the equipment, the syringes, the other supplies, et cetera, and people to give the vaccine. So that I would do. The other thing is to involve other trusted people and institutions in the community. And I'm pleased that you asked the question, because I would like to add to Dr. LaTonya Washington's comments. One of the institutions in the Black community is the Black Church. There's a program underway that is being coordinated by Ms. Deborah Fraser House, involving Black ministers. The co-chairs of this effort are Reverend Calvin Butts of Abyssinian Church in Harlem, and Al Sharpton, also in Harlem. But they are having leaders of Black churches in Detroit, New York, Newark, Washington, D.C., and Atlanta, where Reverend Warnock here in the Ebenezer Church is involved. And they're working to spread this, because we in the health professions need all the help we can get. Because the problem we have is with the confusion that has developed, along with some unfortunate things in our history where people are distrustful of the health system. We need partners in the communities who are trusted, who can say to their neighbors and to their friends, this is good, you should do it, it is good for you. Because we have really the contradistinction of fabulous science that's made this great vaccine available in a short period of time with scientific rigor. But because of the circumstances under which it was developed and the unfortunate history, such as the Tuskegee study, people have a lack of trust in the system. So we need to work to do that. Because one of the things which I did when I was secretary, we started the Healthy People movement. That was designed to improve health literacy in the community, because if you are literate in health issues, you can be more in control of your own health. You know how to get vaccines, the proper nutrition, exercise, not smoking, avoiding addicting drugs, etc. Many of the health problems we have are because of behavior. So we need to do that. So those are the things that I would do. And so I think all of the efforts that are underway ought to be commended. The National Academy of Sciences is also working to show its endorsement of the vaccines. Yes.
I'd like to interject a question, Dr. Maxey. Dr. Maxey, this is Dr. Williams. I'd like to ask a question along the same line that you asked in regards to Dr. Sullivan's involvement and action as Secretary of HHS. Lou, you might remember a precipitous action that you took when you were secretary in regards to protecting actually the Black and other minority community from a situation that arose with what was called Uptown cigarettes, and the action that you took. Could you describe that? And could you tell us how you would apply that kind of, I guess you might say, aggressive use of the power that you possessed as a secretary to help to protect the Black community?
Right. Well, thanks very much. Yes, the Uptown incident involved the effort of R.J. Reynolds to introduce a new cigarette. They were going to test market it in Philadelphia. And it was a non-filtered, high tar, high nicotine product that they called Uptown because that was a phrase used in the Black community if you were going uptown, et cetera. So this was clearly targeted toward the Black community. And at that time, and we still today, have the leading cause of preventable death is tobacco use. So I was, by coincidence, I was scheduled to speak at the University of Pennsylvania at the dedication of a new building built with federal funds. And when I went to speak at the dedication of that building, I castigated the company for its temerity in trying to introduce this product, saying that this would be a death sentence and also cause disability in the Black community, and was not worthy of a major American corporation to be visiting such a product on the citizens. So that is what happened. And the other thing that happened with that was this. In the Bush administration, the process that all of us agreed to was if I was giving a public speech, I would send my talk over to the White House a week before to have it cleared, because we wanted to be sure that we were doing things in line with the policy of the administration. We wanted to have the Secretary of Education, or the Secretary of Health, the Secretary of Housing, really generally speaking from the same thing. But I didn't send my speech over because I knew that the tobacco companies would try and have some of their former employees working in the White House. So I decided that rather than risking being told that they wanted to modify my speech, that I was going to give the talk. And I knew when I went to Philadelphia that evening, I might be on my way back to Atlanta for really not following the policy. So when I spoke, I learned that the tobacco companies had indeed called John Sununu, the chief of staff. They were very upset. And so he told them, well, I'll speak to the president if you want, but you'll have to abide by what he decides. They backed off. I never heard anything. So, but I was prepared to return to Atlanta as a private citizen because I felt that my integrity as the chief health officer for the country, my integrity would be torn if I did not speak out against that. And so that's one thing that I respected about President Bush. He knew that what I had done, but I was not reined in, I was not scolded, et cetera. But he supported what I did. And he also, I served with him because I knew he supported Black colleges and Black education. In fact, as a student at Yale, he was the chairman of the United Negro College Fund student drive during his years as a Yale undergraduate. And his mother, his mother was one of the founders of the UNCF Board of Directors, yes.
If I could ask you one short question before we move on, we're running close up against the clock. And that is, we have in our community a lot of activity of people against vaccines, some people for vaccines. I'm wondering, again, how would you encourage, from a power standpoint, how we can get the message out more to our people to listen to science and listen to reason, and how would we oppose those who would seek to misdirect the Black community? And I just wondered if we could do that in a short answer, and then we can move on and ask some questions later.
Well, all of us need to tell our neighbors, our friends, our communities that we support the vaccine, the importance of it, use our leaders as we're using the Black ministers, and to emphasize the fact that this has been produced with the greatest of scientific rigor, and this vaccine is safe. Unfortunately, the people who are against that vaccines, a lot of them are confused and are misinformed. There's the misinformation that vaccines are related to autism. That is not correct. There was a study in Lancet magazine in the early 1990s that said that, but that study was retracted. And a lot of studies have been done by epidemiologists since that time, which clearly showed there's no relationship to autism from vaccines. So we have to indeed get the word out. That's one of the things that I say the Healthy People movement to improve the health literacy of our citizens is very important. So that's what I would do. We need to have everyone working with us, whether they're ministers, clinic leaders, YMCA directors, others. We need to have friends and colleagues in the community who are trusted by the community to work with us as health professionals in getting that message out.
Well, thank you so much, Dr. Sullivan. I'd like Dr. Augustus White to get briefly introduced by Dr. Williams. And let's get Dr. White, who's another hero. Can you introduce him quickly, Dr. Williams?
Before we go on to Dr. White, I want to say one other thing about Dr. Sullivan, who is obviously one of our greatest icons and extremely charismatic as not only the chair or the secretary of HHS, but in other capacities as well. Dr. Sullivan, would you like to say something in particular about the books that you have written? Because we want to make sure that people have an opportunity to look at those books. Remember what I said about those being our written legacy.
Well, thank you very much for asking. I happen to have them here. I will show you first. This first one is called Morehouse Mystique. It's a history of the Morehouse School of Medicine, how it came about. It was very interesting because it involved leaders in the community who really wanted a medical school and came to Morehouse College and urged the college to undertake this. Fortunately, Hugh Gloster did respond, and that's how it came about. But people such as Andy Young, in addition to Louis Brown, Ed McIntyre, mayor of Augusta, others wanted this medical school. So with their support, we developed it. The other book, the first book on Morehouse was printed by Johns Hopkins University Press. The second book is my autobiography called Breaking Ground, published by the University of Georgia Press, received the NAACP Image Award for Outstanding Autobiography in 2017. So I'm very pleased with that.
How can that be obtained?
Oh, yes. You could get it on Amazon or you could email my office. We have a few left in my office. So you could email me at sullivan@PEMSM.com. But the final book I'd like to mention is still being developed. We formed an association of minority health profession schools back in 1977, which ended up being all 12 of the predominantly Black schools of medicine, dentistry, veterinary medicine, and pharmacy. It includes Howard, Meharry, Morehouse, and Charles Drew in Los Angeles, and the two dental schools at Howard and Meharry, and the pharmacy schools at Texas Southern, Xavier, Florida A&M, Hampton, and Howard. This association worked to develop policies to support the education of minority health professionals, and we worked to have created the National Institute for Minority Health and Health Disparities. So that will be out later this year, but that's another story where the institutions came together, worked together to form an institute that now is going on and providing support to improve health status of minorities and eliminate health disparities. Thank you.
Thank you. Thank you very much, Dr. Sullivan, for all that you do and for that excellent presentation. And now we're going to move on to our fourth panelist, who is Dr. Augustus White III, the Distinguished professor emeritus at Harvard Medical School and emeritus chair of the Department of Orthopedics at Beth Israel Hospital in Boston. As I mentioned, Dr. White, Dr. Sullivan, and I were all in Boston at the same time in the 1960s doing different things. I was a cardiology fellow and eventually an instructor at Harvard Medical School in cardiology. Dr. White was, as I mentioned, the chair of the Department of Orthopedic Surgery at Beth Israel Hospital in Boston in the Harvard Medical System. And Dr. Sullivan was the chief of hematology at Boston City Hospital. So we were all doing our respective things there. And I think we were doing them very well on behalf of especially the minority community in Boston. And then we branched out from there. It's interesting that we're reconnecting now and sharing these various stories about our lives and careers. Dr. White has really quite a career to tell you about. And I don't know how he's going to be able to get all that out in a few minutes, but he's a wizard at doing a number of things, including writing books and giving lectures and making appearances. One of the most amazing people that I've ever met, one of my closest friends, and I consider him one of the huge giants in our history of medicine, not only for African Americans, but for anybody. And Dr. White will tell you much more about his career, as only he can portray it. He has these special things that he has to relate to you. So without further ado, Dr. Augustus White III.
Thank you, my friend. Thank you very much. I guess I'll start with a simple concept of peer mentoring. And that concept will be further developed. Are we okay? Am I getting through okay?
Yes.
You're fine.
Yeah, okay. The concept that we are developing is right here before us today in the person of Richard Allen Williams, who was one of my earliest peer mentors, a person that I was referred to from a variety of different sites as someone to help me get moving and develop some constructive peer supported activities to address issues of integration, equitable care, and organizing us as a group of orthopedic surgeons to have an organization that can work together and address issues within our profession. And as I spoke, everyone said, well, talk to Dr. Richard Allen Williams. He's doing wonderful things with the development of a cardiology society. And I contacted him, and immediately he was full of ideas and encouragement and support and information to get us moving. So as we celebrate Mentoring Month, and I've had some wonderful mentors, I'm going to say a little more about that, but certainly Richard Allen Williams is one of my first peer mentors and was just exemplary in his help and in his impact on what we were able to do in orthopedics. And that organization that he helped us and directed us to start exists right now. It's the J. Robert Gladden Orthopedic Society. So that's one of my things I would like to mention about my career. And I have another example of a peer mentor. And I don't know if it'll show up on the picture here or not. Let's see what it'll do. Oh, that works. And there are some people that you know. The person there smiling with the big smile over there is our featured fellow guest, Dr. Lou Sullivan. You see him. And next to him is my dear spouse who keeps me alive and well. And she's a peer mentor too, really. And then my youngest of my three daughters came with us, and we went to Washington to visit. And there's Ginger Sullivan, and she and Lou hosted us wonderfully. And that's just a representation of the beautiful example of peer mentoring. So I thank you for that, Brother Sullivan. I thank you very much. And you continue to be a substantial mentor. And so I'm here with my mentors. Otherwise, I'd have no business being here. You know, I wouldn't be in this league if they weren't for my mentors. So thank you. Thank you for that. Well, as I sit here and listen, I want to try to be helpful. I want to try to do some good. I want to try to share a few of my thoughts and ideas, which are not evidence-based, but they're things that I believe in and have been helpful to me in a variety of different ways, and I trust will be helpful to others as we begin to share them. And it's just going to be a few simple concepts, a few things that we're supposed to talk about my life and my experience and my journey. And I'm going to start with another mentor, actually. And that mentor is my mom. And she somehow taught me from early age. I don't know what words we were using then, but basically she communicated to me the following concept: treat all people with respect. Treat all people with respect. Wherever you meet them, whoever they are, wherever they are, whether they're above you, below you, peers, but treat them with respect, and include yourself amongst those. And be sure that no one could ever accuse you of being disrespectful. And just be confident that that's the case, and treat all people. And I don't want to say a lot more about that, other than I can't tell you how many times, I don't even remember how many times it came back to me where someone gave me a bit of a nudge, helped me out a little bit. And just because, I had treated them decently and treated them with respect. So in an attempt to try to do some good, I'm going to mention a few little concepts that I would like to share. Another one is a word that I've seen a lot lately, and I'm happy to see it, and I want to share it again. And I think we need it in this world. We need it in our medical world, but we need it in the world. And this word is empathy. There's a need for, there's a tremendous value in empathy. And empathy enriches and helps the empathizer as well as the empathizee, if you will. When we help others, but we also help ourselves. It makes us feel better. It enriches us. It advances us. So I think empathy is worthwhile. I think it's worthwhile in doctor-patient relationships. I think it's worthwhile to even suggest, as we mentor other individuals along the way, that people empathize. In fact, we even talk a little bit when we talk to medical students about when you first encounter your patient, when you first meet your patient, humanize your patient. Relate to your patient in a way that the patient somehow recognizes, and you recognize in your mind and in your heart, that you are being empathetic and you are humanizing this particular individual. And it doesn't have to be any one way to do it, just do it. Look him or her in the eye, show interest, and even talk about the weather. We all talk about the weather. We relate to the weather as fellow human beings. So I like to try to suggest that when I'm talking to students as a beginning of being able to provide humanitarian, equitable health care to our fellow humans. Again, a close word, compassion, I think is important to keep in the picture and make a part of our activities to go with our scientific expertise and our other talents that we bring to the use and to the help of our patients. Another word that I've sort of popped into my mind, and I was at Duke University, where it has developed a wonderful program of training physicians in the skills and talents of leadership. A dear friend of mine that I was in Vietnam with, Dr. John Fagan, who was one of the first West Point graduates. They went all the way through his medical profession, his medical training seamlessly and with tremendous contributions to our orthopedic profession. And he realized that many physicians end up in positions of leadership, but have, for the most part, many, all too frequently, no leadership training. And so he's developed a fellowship at Duke, which has gone very, very well. And the fellowship addresses leadership skills and leadership training for physicians. So being at Duke has exposed me to that. And I've gone back. He has things in the summer every year, and had a chance to go back and speak and communicate with some of his other outstanding leaders, one being the famous Coach K, the great champion coach who's led us to so many Olympic championships. And he and Dr. Fagan worked at West Point and developed some wonderful programs for leadership training. So I think that's something worthwhile and worth considering. And when I visited that and I just experienced what was going on, another word came to me that I have embraced and been respectful of and appreciative of, and it's simply positivity. Positivity. Just let's be positive. Let's try to do the right thing. Let's be active and just do it because it's the right thing to do. And this creates an atmosphere which generates more positive behavior, more positivity, if you will. Another thing that I like to talk about is when we're trying to share ideas and mutually enrich and embolden one another is the concept that has come to mind frequently, and that is to try to do the right thing within our sphere of influence. We all have a sphere of influence. Not many of us have the kind of sphere of influence that my fellow panelists have here. But wherever we are, whatever we're doing, there's some things around us within a certain amount of things we can do to do the right thing. And our brain is really constructed. It has elements that serve as a nucleus for encouraging us and helping us to simply do the right thing. And I think that's something worth trying to share because to the extent that we do within our sphere that we can control, whether it's our office, whether it's our family, whether we're CEO of a corporation, or whether we're someone just doing their job to try to make things better within the sphere that their job entails. So I think that's something worth sharing and worth encouraging ourselves to do. And another reason for this, and a reason that this is important as we go forward, as we try to change the big picture of eliminating racism and sexism and ageism and all of the wrong things that we do, to the extent that we do the right thing, it adds up. And I think that adding up has been very well expressed by Robert Kennedy. He says, each time a man, and I insert a man or woman stands up to an ideal or acts to improve the lot of others or strikes out against injustice, he or she sends forth a tiny ripple of hope, and crossing each other, these ripples of hope form a million different centers of energy and daring. These ripples build a current that can sweep down the mightiest walls of oppression and resistance. And I really believe that. I believe that is real, and that is what happens. And that's what's going to get us past these horrible racial realities that we're contending with, and we have to improve. And we're all trying to improve. We all want to improve. But to the extent that we stay on the case and we consistently do the right thing within the realm that we have power, this will make the kind of change, and may actually be the only thing that can make the kind of change that is needed, so dearly needed in our world today.
Dr. White, if I can ask a question.
Yes, sir.
From what you're saying, you are professing the ideal that our physicians should have, and rarely in our workaday life where we're busy, we're trying to make money, we're trying to get out of the office, trying to go on vacation. And you're bringing out the human aspect of why Black physicians are so important, not only intellectually, but spiritually and human-wise to our patients. And this is so great. And I like that. What's the name of the book you wrote about seeing patients?
Yes, sir.
That is so important. Many times, majority of physicians don't take into account that we're not just a patient number 505, but we're actually a human being. And how you humanize us and how you talk to us will affect the outcome of the care that they prescribe. Is that true?
That is so true, sir. And thank you for mentioning that. We have expressed some of these views of our patients, seeing patients, a surgeon's story about history of race in medicine. And I really appreciate you helping me to emphasize that point, because you're right on target. And this is such an important part of what we want to do. And I should mention, actually, we have another book which is coming out on the 9th of February. It's available to order on Amazon now, and it's called Overcoming. And it emphasizes in part just what you said about our common humanity. But the book is entitled Overcoming, and it's the subtitle is Lessons in Triumphing Over Adversity and the Power of Our Common Humanity. The power of our common humanity.
That is so important. So many of our physicians don't have humanity. We got smarts, we know the chemistry, but we don't know the human chemistry as well. And I thank you for that. I have an orthopedic question for you, and I'm going to ask Michelle to look in the chat box. But many of our people are in bad physical shape, especially we're locked in and shut down. And I believe that, and I do some regenerative medicine, many of our people are overweight and there are orthopedic concerns. And I know you're talking far past just being an orthopedist, but what are some of the things that we must, should, and have to do in terms of our bodies and our orthopedic problems, arthritis, and the effect of weight on weight-bearing joints during this pandemic? Is motion important? Is movement is important? And what's your view on what we can do while we're locked up at home?
Interesting point, Dr. Massey. I should respectfully compliment you and point out your wisdom and your insight that I participate in, and there exists an organization called simply Movement is Life. And I think that's part of what you have so appropriately focused on and emphasized. And I'm glad you did it, because I hadn't put that in my comments, and I should have. Movement is Life is a group of a multidisciplinary group of organizations who of individuals who constitute and represent a number of different professions: doctors, nurses, physical therapists, even lobbyists, even people involved in various types of exercise programs. We have attorney, we have people involved. And what we're trying to do is put together an organization that can address these healthcare related social determinants of health, and through education, and as you imply, through having people know and understand the importance of exercise, the importance of control of their weight, and other types of health effects, to improve their opportunities, and for them to know and understand, and for us to help to eliminate the social determinants of health that are impacting our patients and these individuals. And I think it's fair to say that this group has been supported financially for 10 years, and has been going very strong under the leadership of a very capable African-American woman who had worked in the in industry, the orthopedic industry, the implant industry, as a distributor actually of instruments. But her leadership skills were recognized, and she's now being involved and has been involved for 10 years in this organization called Movement for Life. I think Dr. Sullivan I know he has been aware of it and has presented to us as well. But it's, and Zimmer Corporation, I think it's just to say, and that sort of touches upon and overlaps in the, Dr. Sullivan, I'm sure will know the proper name, but the yearly group of business leaders, CEOs, about probably 6 or 8 months ago now, who got together and said, we want to revisit our corporate mission. And our corporate mission should not just be return on investment, but should be our commitment to our communities, to our employees, to our personnel, and to all of the groups that our corporation impacts. And we need to include among that concern for the community, support of the community, and again, a humanitarian approach. And this is out of the corporate milieu.
Well,
So thank you for mentioning that and bringing that up.
thank you so much for being with us today. I'm going to ask my two co-moderators, Dr. Ivan Walks, who's run the DC Department of Health in the past, and us having a former secretary here, and Dr. Barbara Neighbor Stevens, who's the vice chair and runs managed care companies, with Dr. Williams, who has been my personal mentor, professionally and personally. I'd like to know, as we go towards our close up, are there any questions in the chat box? And would Dr. Ivan Walks have a comment or question of any of our guests?
Dr. Maxey.
Stevens, yes.
Dr. Maxey, Dr. Williams here. I wanted to make sure that we got everything we can get out of Dr. White, and he's holding a lot back. I'd like to point to one thing in particular. Many years ago, I was fortunate to be invited to a conference, an international conference of the J. Robert Gladden Orthopedic Society that he cited, which was held in Switzerland. And that was a wonderful trip. I mean, I hope that you're going to do that again, and I'll be invited again, Gus. But at that, on that trip, there were a number of concerns, especially about healthcare disparities affecting African Americans, and especially in regards to orthopedic surgery. One of the concerns was limb salvage, and the fact that many African Americans who have diabetes, for instance, lose their limbs unnecessarily because of the fact that they are not considered in the same vein as perhaps whites who have a similar problem. I wondered if you could just make a brief comment about that. It's so important for us to keep these things in mind as we move forward. And you've done so much work in the area of healthcare disparities. We need to make sure that everybody recognizes that.
Dr.
Sure.
White?
Yeah, well, thank you. Thank you for that. I mean, some of the examples, and you just mentioned one, are screamingly obvious. And we know that. I mean, the statistics are overwhelming and they're grossly inhumane. I mean, one of the favorites is African-American goes to the emergency room with a fracture, a long bone fracture, a major long bone fracture, the diagnosis of which is hardly debatable, readily documented, known to be extremely painful. And the chance of that African-American getting pain control for a fresh long bone fracture is about 50% as likely as it is for a young Caucasian male going in for that. And that's just one of so many examples. And of course, the examples, if you a woman and you go into the hospital with a heart attack, the chances of you surviving is much less if you have a male physician than if you have a female physician. And it goes on and it goes on and on and on. And we have to stay with it, and we have to fight it and fight it and fight it. And constructively offer alternatives for training, and things are going on to try to eliminate. We're getting pretty good at recognizing the healthcare disparities, but the next step of eliminating them is, of course, a real challenge, but that is being worked on, and we must be assiduously continuing to advance those chances for change. And this is the kind of thing that this Movement is Life group advocates for, including, as I said, some good strategic lobbying activities to help to move that agenda.
And one last thing, Dr. Maxey.
Richard, just a moment. We've got a few more minutes before the program has to end. I want to make sure we have a few minutes to have questions from the audience. And also we have one or two announcements to be made. Are there any questions in the chat box, Michelle or Dr. Neighbor-Stevens?
Yeah, I'll read one of the questions that goes right to the heart of the COVID vaccine. So what do we say, and I'll actually read the response from Dr. Walks as well, but it says, what do we say to folks that don't see the point of getting a vaccine if we still have to wear a mask after taking the vaccine? And Dr. Walks' response in the chat room was, the vaccine is intended to keep us safe from COVID illness and stop the virus from having us as a place to replicate. The reason to keep wearing a mask and keep to a safe distance from others is to both model correct behaviors for others, and especially with new variants appearing, prevent asymptomatic spread of the virus. We have to keep our prevention behaviors up until we have herd immunity and get the all clear from the scientists who are following the spread of COVID to the point our loved ones and our community are no longer at risk. I think that was an excellent response.
Good question and an even better answer on that. Any other questions in the chat box or comments?
I think I'll just defer to Dr. Neighbor-Stevens and we'll just round out our panelists. I know we're pressed for time at this point.
Dr. Neighbor-Stevens?
Thank you. We realize that this is an ongoing saga, an evolving tale. We are a year into this journey now, and we know a lot more than we knew a year ago, but there's still a lot more for us to learn. Please stay with us. We have programs coming up in the next few weeks that will be addressing the continuing story of the mutations that are occurring, the types of vaccine available, what their advantages are, what their disadvantages are, and we'll continue to update you with information that is reliable and data-driven so that you can protect yourselves and your loved ones.
Dr. Maxey, Dr. Neighbor-Stevens,
Yes.
First of all, I just want to say that you all made the mistake of making me a co-moderator and unmuting me. I have to say one thing. When we have folks like Dr. White, Dr. Sullivan, Dr. Allen, the joy of it is that we get to hear their values. We get to hear what they've accomplished, but we get to hear their values. And those values are amazing for us. Just let me pick one. I saw 3 African-American men uplift each other. Each of them is bad, to use the term we used to use, in their own right. But each of them took the opportunity in their comments to uplift the other. And I think that that is just an amazing thing for all of us to watch, how we can be incredible in the work that we do and at the same time work in partnership with others. I just want to thank the 3 of you for demonstrating that in how you've lived and in how you've presented your accomplishments to us today. It's an amazing thing. And the other thing that I want to just say briefly is that as African-American men, we don't always show that emotion, that caring for one another that we can do. It diminishes nothing that we do, and it uplifts everyone when we do that. So thank you, my brothers. I'm just happy to see you all do that. And a quick shout out to Dr. Washington. In God we trust, all others bring data. My sister, you have brought the information. It was clear. And I am just so proud of the work that you are doing. And I have one last comment. The way we get out of all of this is we encourage people to vote. If we don't vote, then the people who hire the health directors and the people who make the decisions in our communities continue to do what they want for the people who vote. I'm sorry, you told me I had about 10 seconds, right?
No, I didn't. You saying what you're saying. It's so important, Ivan, Dr. Walk, that we have the caliber of doctor and health professional that we have in Dr. Williams, Dr. Sullivan, and Dr. White. And I said I had goosebumps. I still have them. And I always tell Richard, and I'll tell Dr. Sullivan and Dr. White, when I grow up, I want to follow in your footsteps and be just like you. So I am extremely happy. And in fact, I'm going to ask Dr. Williams if we can get this panel together again. We want to do a podcast, but we don't have the time constraints that we have on this type of broadcast. Dr. Stevens, Dr. Walton, any last comments as we get ready to close?
Just that I look forward to seeing everyone next week.
Very good. Thanks, everybody. Thanks to our distinguished panel headed by Dr. Richard Williams and with Dr. Lewis Sullivan and Dr. Augustus White. Thank you so much for making the rest of us good physicians, good caregivers, and good providers. Thank you so much.
Happy
You're very
Black
welcome.
History Month.
Take
Happy
care of
Black
everyone.
History Month.
Thank
See
you.
you next week.
Thank you.
Take care.
Bye.
Thank you.
Goodbye.